I wonder.
There we go.
All right.
We're live.
All right. We are live. Let people start filtering in here. Hi, everybody. We're just saying hi here for about 30 seconds as we wait for folks to filter in. So excited to have you here. Yeah. Drop in the chat. Where are you joining us from? Let us know in the chat.
Yeah. I'm here in St. Pete, Florida. It's a great place. We're having great weather right now. I don't know about you guys, but
oh yeah. LA, can't complain ever about the weather here. It is beautiful. Oh, we've got Corey, we've got Carrie from Rockford, Illinois. Hi, Carrie. Oh, Jackie, hello to you from Colorado. Hi, we've got Ottawa, Missouri, New Jersey. Wow. All over. Norfolk, Virginia. I'm from there. Williamsburg, Virginia. California.
Amazing. Oh, I see. Yep. A couple Californians here. Oh, good.
Bridgeport. Awesome. We're so excited to have you guys here. We're just going to give it about another 15 seconds as folks filter in, and then we're going to jump in.
Yeah. Hi, guys. So glad you made it tonight. Nothing better in a Thursday evening than tuning in to learn about our bodies and our health and how we can make improvements. Something I love talking about. So really excited to be here.
Yeah. We're so excited to have you. So excited to have you all.
And it's spooky season, so don't forget your special spooky water. Bring your water to the webinar.
Yes, everyone stay hydrated. All right. Okay, so hi, everyone. My name is Courtney Davison. I'm Forks Over Knives managing editor. Thanks so much for joining us today. We're really, really excited to have you here. We're going to be talking all about menopause and inflammation, two hot topics, pun sort of intended. We're going to be talking about the science-backed strategies for turning down the heat. I'm so thrilled to introduce our guest, Kylie Buckner. Kylie is a registered nurse with more than 20 years of experience in healthcare and a master's degree in nursing education. She's served as a nurse in the neonatal intensive care unit in labor and delivery and as director of operations for an OBGYN clinic. She's also a health and wellness coach specializing in reversing insulin resistance, and she's dedicated her career to helping people achieve lasting health and vitality. Kylie's also been plant-based since 2011, I believe. And she brings both professional expertise and personal experience to her work. And I know we're all going to learn a lot from her today about this huge, sometimes confusing topic of menopause. So please be sure to stick around to the very end of the webinar, as we'll have a special deal from Forks Over Knives, and we'll also be getting to your questions at the end. So with that, I will hand it over to you, Kylie.
Awesome. Thank you so much. And I'm so excited to be here. I've loved Forks Over Knives for so many years. I've recommended Forks to so many people, and I'm grateful to have the opportunity to participate in this. So thank you for having me. I will go ahead and load the presentation, turn my screen share on so that we can get into the presentation right away. We want to be respectful of everybody's time here, and there's a lot to talk about. So we're here talking about inflammation and menopause and really using practical evidence-based strategies to reduce inflammation, ease symptoms of menopause, and enhance the longevity and quality of life during and beyond menopause. And as Courtney mentioned before, let me see here. Excuse me. I'm not sure how to move through my slides.
Joy of the live webinar experience.
I know, exactly. Hello, live. Well, this will make you sweat a little, huh?
Yeah, right.
Talk about making you sweat. We talk about turning down the heat around menopause, and it's kind of a clever little term just in terms of, the idea of hot flashes being part of the experience of menopause, and they certainly can be. And we're going to talk about how to help to minimize that. And I've just figured out the answer here. So does that work? Did that move my slide?
It did. Yes.
Oh,
we see the next slide with your background.
Hip, hip, hooray. Okay. Well, as Courtney mentioned, I have been a nurse since 2001, and I started my career in neonatal intensive care nursing. So I saw somebody ask a question about how could we be, focused on menopause here? And, while I haven't experienced my own menopause yet. I am 46 and I am starting to notice some changes in my body for sure. So I have spent many years working with women in all different ages and stages of life. In my traditional healthcare role, I was in the hospital setting. And then as a coach, as a health and wellness coach, I've been helping people since 2017 adopt lifestyle changes to reverse insulin resistance. And along the way, I have gleaned so many insights around what is below insulin resistance, which is inflammation, and what it does in the disruption of these natural processes in our body. And so I teach people tools that help to make lifestyle changes stick. And I've really enjoyed how my career has been able to take me from the NICU, where I took care of these special little preemie babies, all the way through women into their 80s, 90s, and beyond. In fact, my goal is to work with a centenarian at some point. I think that would be so cool. But I've also experienced the firsthand effects of inflammation in my own body. And I'm going to go into that a little bit. Part of the work that I've been doing in terms of lifestyle change and helping people adopt a plant-based diet to minimize their general inflammation, it also, as it turns out, helps to reduce things like reversing type 2 diabetes, reversing prediabetes, reversing hypertension, reversing hypercholesterolemia or high cholesterol levels. So I've literally seen the firsthand effects of this work over the years. And so I love helping women to connect the dots between inflammation and shifting hormone experiences during menopause. And I've seen it firsthand with my own eyes. So some of you may know this guy on the screen. His name is Cyrus Kambata, and he is my husband. He wrote the book Mastering Diabetes. And for years, we worked together in our coaching program with Mastering Diabetes. And this is where I really learned about the importance of the hormone insulin. And I've learned so many things from other women's experience. But Cyrus and I take inflammation really seriously. And while I was for over 20 years, I was actually living with endometriosis that I didn't even know about. And the discovery came while I was trying to conceive, as it basically held my fertility hostage. So at 40 years old, I learned I had stage 4 endometriosis. And what I learned was that inflammation was actually, again, hijacking these natural body processes. It was causing my periods to be really uncomfortable and unpleasant. Not beyond that, to be honest. I mean, I was out of work for days around my cycle. And it wasn't just menstruation, but it was also my fertility. So all of these natural processes in my body were being hijacked by this inflammatory disease known as endometriosis. So again, in working with so many women going through their menopause and perimenopause, I had this like light bulb moment of, well, if inflammation can worsen my menstrual symptoms and take over my fertility, could it also be causing worse menopause experiences? And the answer that I have seen over and over again is the answer is yes. So I've really put into practice these tools to help women take control of the underlying condition that is leading to the worsening symptoms of menopause. So that personal experience is one of the core whys behind today's presentations. And it's really why I'm so passionate about sharing this with you. And I have to tell you, working in the neonatal intensive care unit was such a special time of my life. And I love being there, and I saw lots of miracles. But when I work with people who are really trying to take control of their own personal health and understand how their body is working and connect the dots between the lifestyle choices that they're making and the outcomes in their health, that is a miracle unto its own. And I have just been so humbled by the power of choice and what people are actually willing to do when they get the right tools at the right time. So that's why I'm here today, to help you maybe on your journey somewhere along the way. So just some kind of basics here. Like I was talking about menstruation and fertility, menopause is natural. It's a natural part of our progression as women. And, as we age, our bodies go through changes, right? And that happens at multiple times of our life. Our bodies naturally go through changes when we hit puberty in our, earlier years, and our bodies naturally go through changes as we approach that menopausal time. So it is a natural part of our existence, and the symptoms are often modifiable, right? We are living longer than ever in our postmenopausal bodies, and we're also living in an environment and in a world that is more toxic than ever, right? So this transition of menopause is not a disease. And while symptom intensity varies from person to person, it can be very significantly impacted by inflammation and stress. So the good news is that you do have agency over this. And that's something that once you sort of start to play around with some of the tools that are in your hands, some things like daily food choices, improving sleep or strategies for improving sleep, daily movement in your body, and even stress management, those things dramatically reduce symptoms and improve your overall metabolic health as well. So what exactly are hormones? Because I'll tell you, when I think about my my social media feeds or things that are being sort of fed to me in that way, I'm being told that hormones are really bad, right? They need to be in balance, and there's tons and tons and tons of supplements to help me bring them into balance. So if you're experiencing that in your world, maybe just put a little message in the chat box, say, yeah, me too, because hormones are part of our endocrine system. Our endocrine system is one of the most important systems in our body that basically allows these chemical messengers to move around and influence tissues and cells inside of our body through our bloodstream. So they're chemical signals. Hormones are chemical signals. They're little molecules that basically carry information between cells, and they are very specific. Each hormone has specific target receptors and a specific job to do. And they rely on they have their own regulation in a way. So they rely on these feedback loops to maintain their own balance. So our brain is a big part of that regulation, where our hormones are actually able to, change in the quantity based on feedback that they're getting from the cells in our body. And the other thing about hormones is that they are rather potent. Small amounts of hormones can produce very large effects. So even small shifts in hormone changes can actually create big effects in our bodies. And hormones basically coordinate complex physiological processes like metabolism, reproduction, growth, and stress responses. And I think for most women, especially if you've gone through different phases of your life, from puberty through maybe fertility and pregnancy, and then into menopause, you are aware that there are specific hormones that are responsible for our reproduction. So this is what the endocrine system is made up of. It's made up of glands. And the endocrine system is our body's communication network. So it starts in the brain, and we have multiple glands in our brain that are triggering certain effects. So we've got our pineal gland, the hypothalamus, the pituitary gland. Maybe some of you are channeling some memories of high school biology right now. We also have a thyroid gland that's responsible for thyroid hormones. Thymus is responsible for making things like our immune system, cells and hormones that impact our immune system. And then we have things like our pancreas and adrenals, which help regulate things like insulin and stress hormones. And then down here are our ovaries, which are responsible for some of our reproductive hormones. And so you can think of the endocrine system as your body's internal internet. The glands are like little broadcasting stations that are sending chemical messages or hormones through your bloodstream to specific target tissues. And the way that this works is that glands are releasing hormones into your bloodstream on a constant basis. And sometimes it's in response to other things, but those hormones will bind to specific receptors on the target cells, and this will trigger cellular responses and physiologic changes, right? So, and by the way, there's over 50 hormones in our bodies, which is incredible. There's over 50 that they've yet discovered. So who knows, there could be more in there that we don't even know about yet. But this is important to know that, these specific hormones are responsible. So for example, a good example of this is where our pancreas is producing insulin. And in our house, my husband lives with type 1 diabetes. We love insulin because if we didn't have insulin, he would not be able to function properly. So the pancreas is responsible for producing insulin, which in turn meets up with glucose and will take the glucose into the cells where it belongs. But the insulin doesn't do this on its own. The insulin is actually supported at the cellular level by thyroid hormone and by vitamin D, which is a vitamin, but it acts like a hormone in a lot of ways. So the insulin actually does interact with other hormones to do the work that it needs to do, getting the glucose out of the bloodstream and into the cells. And the reason that balance in hormones matters is that when you have too little hormone or an underproduction of hormone, like in the case of somebody living with type 1 diabetes, where the pancreas is no longer producing sufficient quantities of insulin, when you have too little hormone, then you end up having underfunctioning of the target tissues. So too little insulin equals no glucose going into the cells. And that means that the glucose stays inside your bloodstream. So when you go get your blood glucose checked or you get your A1C checked, it shows elevations, right? Same thing with having too much hormone. Sometimes overactivity can cause potential damage to tissues. So we do want to keep our hormones in balance. There's also timing and coordination between the different hormones, which is also crucial to functioning. For example, like I was talking about earlier, the coordination between hormones matters when it comes to glucose uptake. So the insulin meets things like thyroid hormone and vitamin D to actually help regulate that glucose into the cell. So that balance really does make a difference, and it is important. So when hormone disruption happens, you can start to see symptoms arising in your body when communication breaks down, right? Or if underproduction is happening. So for people who are underproducing insulin, the side effects can be anything from, losing weight to frequent urination to really active thirst, really unsatisfiable thirst, brain fog, poor memory, poor concentration. So there's a lot of symptoms that can come out of disrupted hormones. And then as it turns out, and this is kind of a key point here when it comes to our topic today, is that inflammation interferes with hormone signaling. So when we have inflammation underlying in our body, that actually interferes with our hormones' abilities to signal properly. And it also interferes with that feedback loop. Okay. And as it turns out, stress and lifestyle factors can also disrupt this delicate balance. Sorry.
No, that's fascinating. Inflammation is really at the root of so many things with our bodies, it seems like. So it's really fascinating hearing how interconnected these are.
Yeah, absolutely. It really is. And we're going to dive in a little bit deeper and talk about some of the more specific hormones because, just seeing where the glands are in our body, our whole body is involved in this endocrine system, just like our cardiovascular system, just like our respiratory system. All of these systems are important to understand how they're working in our body so that we can support their functioning as optimally as possible, and I always say to Courtney, this is something I say all the time, is that we have these bodies, these incredible bodies that works like a beautiful symphony, right? And we're never given an instruction manual. Like my blender has more of an instruction manual than my body ever had, right? So you can kind of think about this talk as a little bit of your instruction manual for your endocrine system, so.
Super fascinating. Thank you.
You're welcome. So we're going to talk about, first, we're going to kind of break down certain hormones here. So for example, we've got our reproductive and our metabolic hormones on this slide. And one of them is prolactin, and this is made in the pituitary gland. And that's a hormone that is involved with breast milk production after childbirth. When it comes to reproduction and menopause, FSH is follicle stimulating hormone, and LH, which is luteinizing hormone, are both produced in the brain. And these are very important hormones that actually stimulate the development of follicles in the ovaries, which leads to ovulation. And so that's a really important part of our menstrual cycle. This hormone plays an important role in our menstrual cycle, and it plays a really interesting role when it comes to menopause. And we're going to get there in a little bit, but it's fascinating. Luteinizing hormone is the other hormone of ovulation. And this is also coming from the brain, and it stimulates the release of an egg from the ovary during the menstrual cycle. So these are both our ovulation hormones from the brain. Then we've got testosterone, which is coming from ovaries and the adrenal gland. This is responsible for things like libido, bone production, our menstrual cycle, actually the beginning of our menstrual cycle, and also tissue and bone mass and fertility. So testosterone for female bodies does play an important role and is produced right within our ovaries. Thyroid hormones. They come from our thyroid gland, and they're responsible for regulating the body's metabolism. They regulate how your body uses energy, how it's responsible for thermoregulation, aka this is something to pay attention to when it comes to our hot flashes. It's responsible for our heart rate and hair, skin, and nail growth. And then we already talked a little bit about the pancreas producing insulin. This does play a role in both glucose uptake to the cells, but also in our growth in general. It's one of the growth hormones. Mm-hmm.
I just want to jump in because there have been a couple of comments in the chat. I know some folks are having trouble seeing the slides. They're a bit small, but I just wanted to recommend to anyone watching, if you click those 3 dots on the right side of your screen, that should help make it a little bigger. And I also wanted to let everyone know we'll be uploading this to YouTube later, so you can go back and revisit it. So thank you. We'll let you keep rolling.
Thank you, Courtney. Yeah, I'm so sorry that it's turning out to be small on the screen. But again, I'm glad that it'll be made available again. Thank you. So this is sort of hormones part 2, and these are stress hormones and growth hormones. And these are important to pay attention to when it comes to menopause, because these are the hormones that are going to be influencing some of that inflammation that we've talked about. So specifically, cortisol comes to mind here, and this is produced in the adrenal glands, which are located right above your kidneys. This is the primary stress hormone that regulates metabolism, immune response, and blood pressure. So it's an important hormone to understand and also bring into balance. The other hormone that is produced by the adrenal glands is aldosterone. And this plays a role in blood pressure maintenance through regulation of sodium and potassium. And then again, the pituitary gland is coming back here for oxytocin and growth hormone production. Oxytocin is the bonding hormone. It's the love hormone. It's involved in our childbirthing process, plays a role in bonding with our newborn babies. And it also helps us when we are, feeling feelings of connection and love for other people and social connections. The growth hormone is also made in the pituitary gland, and this helps to stimulate growth, cell reproduction, and regeneration. So growth hormone plays a role in our tissue regeneration or healing throughout the body. Another important hormone of menopause is melatonin, and this is produced in the pineal gland, and it helps us to regulate our sleep and wake cycles and circadian rhythms. And lastly, on this slide is the parathyroid hormone, which plays a role in regulating calcium and phosphate levels in blood and bones. And this is important to be aware of, again, because of our risk for osteoporosis, which changes after menopause. And again, there's a very specific reason for that. The last 2 hormones we're going to discuss are the key players in menopause. These are the 2 main hormones that are really changing how things are happening in our bodies during menopause. And the first one is estrogen. Estrogen is produced in our ovaries, and it's our primary female sex hormone. And it's the hormone that, when we are in puberty, helps us with development of our secondary sex characteristics. So things like breast development, underarm hair, leg hair, the signs of puberty that, we've all learned about in our biology classes along the way. And so it's also the hormone that regulates our menstrual cycle, bone health, again, kind of going back to the one before when we were talking about the parathyroid hormone regulating calcium and phosphate levels. Guess what? Estrogen plays a role in bone health. And so as estrogen levels decrease during menopause, that puts us at more risk for osteoporosis. Estrogen also plays a role in our cardiovascular function and our brain function. And that also, unfortunately, as estrogen levels drop, we are then at higher risk for cardiovascular disease as well. And as we are moving into perimenopause and beyond, the levels will start to fluctuate dramatically during perimenopause before declining really, really quickly or significantly. And then progesterone is also produced in the ovaries. And this is a hormone that actually helps to balance estrogen. It's considered the hormone of pregnancy. So it actually supports our body in the second phase of our menstrual cycle in preparing for pregnancy. And it also has calming effects on mood and sleep, which again, when we think about some of these side effects and the symptoms of menopause, if our progesterone levels are dropping and we're not getting those same calming effects for our mood and our sleep, we can have mood dysregulation or sleep dysregulation. So production of progesterone starts declining earlier than estrogen as ovulation starts becoming more irregular. So again, the key reproductive hormones in menopause are going to be our estrogen, progesterone, FSH, and luteinizing hormone. Okay, because the FSH and the luteinizing hormone are responsible for triggering our ovulation, and these end up elevating during menopause. So the changes that are happening is that our ovarian hormones are declining during this menopause time. So estrogen actually drops by 90% during perimenopause and into menopause. And progesterone production virtually stops. And our pituitary hormones start increasing. Those are the FSH and the LH. FSH can rise up 10 to 20 times higher than the normal levels, and LH increases 3 to 5 times the normal levels as the pituitary gland is working harder to stimulate the ovaries to produce more eggs. This is the main event of menopause, is that basically these hormone changes are happening so that we can continue reproducing longer. It's basically stimulating estrogen and ovulation, really, because our body is biologically designed to continue reproducing as long as possible. The biologic needs of any living being is one of those is reproduction, right? Is because we want to keep passing our DNA forward, keep passing our DNA along. So we want to be able to replicate ourselves and reproduce ourselves and our genes as long as possible. So ultimately, a lot of the disruption that's happening during menopause is because our brain is trying to stimulate more ovulation so that we can possibly reproduce longer and longer. And that is, when I started really diving into this and pulling those connections together, I was like, that is really interesting, right? To think that it's really just this drive, this biological drive for reproduction that is leading to these hormonal changes. So just as a basic trigger for menopause is the natural aging of our bodies. Menopause typically you can start to see symptoms of perimenopause in the mid 40s. It is a natural biological transition, but it's triggered by our aging bodies. And this fundamental biological process ends up dictating the end of our reproductive years. And then again, leads to these changes in our hormones within our body. So the first thing is that we start having a declining ovarian follicle reserve, and that's our eggs inside of our ovaries. We are born with a finite number of ovarian follicles or eggs, right? But we're born with these, and they're immature eggs. But we're born with all the eggs that we're ever going to have in our body. We cannot reproduce or make more eggs or follicles. And so each menstrual cycle, one follicle is triggered to be released to potentially be fertilized in the reproductive process. And so as we age, though, this natural reserve that we have starts depleting. And as our bodies get older and our ovaries start to age, our follicles start declining. And so that makes fewer available eggs for ovulation. And we end up having reduced hormone production as a result of the follicles declining. And so the ovaries actually start producing lower and lower amounts of estrogen and progesterone because they're like, well, if we don't have any follicles left to fertilize, then we don't really need these hormones anymore. We don't need estrogen and progesterone if we're not going to have follicles to fertilize. So these hormones are crucial for regulating the menstrual cycle and maintaining other bodily functions. So as we see those levels of estrogen and progesterone drop, it leads to the cessation of ovulation altogether. Okay, so then we're going to stop ovulating. And as a result of that, pregnancy is no longer possible. And this is why there are often, during perimenopause, you'll see changes in the length of your cycle. And that's because this disruption of the hormonal feedback loop starts to kick in. So all of a sudden the brain says, wait a second, there's lower and lower levels of estrogen and progesterone. And so as a result, to try to stimulate the ovaries to increase or to release another follicle, it increases the FSH and the LH, right? But unfortunately, the ovaries are no longer able to respond effectively, which leads to just elevated FSH levels in our body. And so these hormonal shifts actually mark that perimenopausal phase. And you can, it's really noted by, or characterized by the fluctuating hormones and the onset of symptoms like hot flashes, mood changes, sleep disturbances, and culminates in menopause once menstruation has stopped for 12 consecutive months. So that's the official definition of menopause. So again, you can see here is like a little outline. You've got your premenopause happening with regular cycles and normal hormone levels. You've got normal estrogen, normal progesterone, normal FSH, normal LH. Then perimenopause starts to kick in because you're starting to have lower levels of estrogen and progesterone. You may see irregular menstrual cycles, fluctuating hormones, and then the symptoms of perimenopause start to kick in. Early menopause is the next phase where your cycles become very irregular and estrogen levels are really dropping significantly. And then there's postmenopause, which is when you have no periods for 12 or more months, low estrogen and progesterone, but also elevated FSH and LH levels. And this transition typically occurs over 4 to 8 years. And the symptoms will often begin in perimenopause when the hormones are the most erratic. So sometimes the beginning of the process can actually be the most challenging to navigate. But I think about other processes and transitions in a female body life, which, is like, I feel like it's almost like another puberty, right? Because in puberty, you're getting this onset of all these hormones at that point where you have irregular moods or mood swings. You've got all sorts of things happening in your body. And, at that phase of life, we're so young, it's hard to know what to do, how to take action on that. Because we can understand this timeline, we can start to talk about decision-making around how to alleviate some of the symptoms or make the process more comfortable. So here's another little just visual for you because you can see here, this is the age in years. So back here between 30 and 35, you've got LH here at the bottom line, and then FSH, which are lower, and you have progesterone and estrogen at the top, which are higher. And as you move along that axis, moving in age, 35, 45, 55, you can see how estrogen and progesterone just gradually decline, but FSH and LH are fluctuating and even getting pretty high at times. The other hormone that's not reflected on this graph is testosterone, and you will see a gradual steady decline in testosterone levels throughout the menopause transition, which can also impact libido and your energy. So let's see here. This entire transition from perimenopause to postmenopause usually lasts about 4 to 8 years. Gosh, not 48 years. With significant hormonal variability during this time.
It's interesting you brought up how it's kind of like a second puberty, and I saw that someone in the chat just said reverse puberty. I attended another talk about menopause recently, and one of the women presenting was saying how she was going through menopause while her teenage children were going through puberty, and it was just like a house full of hormones, and how I guess that's pretty common timing-wise, that women with teenage children are going through that. So fascinating. Absolutely. I do see some questions here about HRT. And yes, I do have some thoughts on that. We are going to discuss that. So stay tuned. That's coming. Yes. Okay. Moving on here, because we want to talk beyond the reproductive hormones. We want to talk about the bigger picture. We want to look at, well, how are estrogen and progesterone, even though they are getting the most attention during menopause, the successful management of menopause actually requires that holistic view of the entire endocrine system. Remember, these reproductive hormones are not working in isolation. Other hormones are equally important in shaping your whole experience. Okay. So when we talk about
hormones like cortisol. Cortisol gets a really big, it gets a lot of attention, and it should, because when our cortisol levels are elevated, the downstream effect is so powerful. It actually can worsen symptoms, especially when when cortisol levels are chronically elevated. Cortisol plays a role in the storage of fat in places that we may not want to be storing fat. Elevated cortisol levels lead to elevated glucose levels, can lead to blood glucose dysregulation. And so cortisol plays a role in this in a very big way, especially when it comes to generalized inflammation in our body. Same with insulin. And when it comes to blood sugar regulation, insulin, and as we develop more and more insulin resistance over the years through possibly poor dietary strategies or other lifestyle other things that we can change with lifestyle modifications, insulin in our body can become less effective, and especially with the declining estrogen levels. Thyroid hormones, they play a role in metabolism and can be affected during menopause transition. And same with growth hormone. And we talked about earlier, growth hormone plays a role in tissue repair and muscle maintenance. So if you're somebody who works out and you want to get the most out of your muscle maintenance, understanding your growth hormone balance is also really important, because it does also decline with age. And this is where lifestyle interventions that support overall hormonal balance are so effective, because it looks at the whole picture, not just at these individual reproductive hormones. So back to some little basics here, which is, why does inflammation change the effects of hormones? So inflammation doesn't just coexist with menopause. It actually changes how your body responds to hormones altogether. Okay. So this key connection is really important to understanding the symptom management. And that will be a part of this, if we're going to get there too, right? So the first thing is the cytokine interference. So when we talk about cytokines, they are part of our immune system response. Okay, so anytime we're dealing with an inflammatory pathway, which leads to our immune system getting activated, cytokines come and they kind of clean up. They're responsible for cleaning up areas of inflammation, cellular debris. They can clean up after an inflammatory process, and they actually can change the hormone receptor sensitivity and intracellular signaling pathways, meaning that it changes how your tissues actually respond to the estrogen and progesterone. And as those levels are decreasing, we want them to be as sensitive as possible. So basically, we want your tissue to be as sensitive as possible to what estrogen and progesterone is remaining in our body, right? So when you have inflammatory cytokines that are there as part of the cellular cleanup, they can actually interfere with available estrogen and progesterone getting into the tissues in our body that they're responsible for. There's another process that's happening here called the HPA crosstalk. And basically, HPA stands for the hypothalamic pituitary adrenal axis. And this is what causes the stress response. So those three, that stress response axis and reproductive hormones communicate bidirectionally, so back and forth with each other. So when we have a chronic cortisol elevation from our adrenal glands, that can often dampen our ovarian function, and it amplifies our symptoms. It makes our symptoms worse. So chronic cortisol elevation is not ideal when it comes to menopause and beyond, because it amplifies the symptoms of lower estrogen and progesterone. And lastly, insulin resistance. And this is basically metabolic dysfunction. Insulin resistance is absolutely rooted in lifestyle, and it causes things like high blood glucose leading to type 2 diabetes. It causes hypertension. It causes high cholesterol, right? So that metabolic dysfunction amplifies inflammatory signaling through adipose tissue. And this can create a feedback loop that also worsens the metabolic and menopausal symptoms. And, I've learned a lot about insulin resistance over the years. It's sort of what I've leaned into the most around health and wellness. And what I've learned going deeper beyond insulin resistance is that inflammation actually is below insulin resistance. And if we can understand that insulin resistance is something that we can adjust and improve and reverse through dietary and lifestyle changes, well, guess what? We cannot do the same thing with inflammation as well, which is actually holding insulin resistance. It's sort of at the root of insulin resistance is inflammation. So in essence, inflammation changes the loudness of these hormonal signals, right? So not just the hormones levels, they're actually literally inflaming or making the symptoms of menopause and the hormonal changes louder. So when you have, when you're in a state of chronic inflammation or high inflammation in your body, it can explain why women with similar estrogen levels in their blood can end up with different symptom experiences. If one person is living with more inflammation, they're going to have a different experience of menopause than the person without the high inflammation.
And I know we're running a bit short on time, but I saw a good question in the chat, and a few people are saying great question. So I think a lot of people were just wondering, how do you define inflammation? I know that's a huge question, and maybe you're going to get into that more later. So just
for sure. Yeah, we're going to talk a little bit about menopause symptoms, and then we'll get into a couple of the, like, how you can measure your level of inflammation, because that's a great question. So just to quickly review some of the symptoms of menopause. We know that hot flashes and night sweats come to top of mind for everybody. And this has to do with estrogen declining. But when we're inflamed and we have these inflammatory cytokines, they actually intensify the frequency and severity of hot flashes. And that's measurable. Joint pain and stiffness is caused by reduced estrogen, and that affects collagen and joint lubrication. And then systemic inflammation contributes to pain, stiffness, and increased risk of conditions like osteoarthritis. Same thing with fluctuating hormones impacting our neurotransmitters around mood swings and causing more irritability. And that can amplify inflammation in our brains or in our gut, can also further cause mood instability as well, which can amplify anxiety and irritability. Sleep disturbances, that's a big symptom that a lot of women are challenged with during menopause and perimenopause. And hormonal changes themselves will disrupt the sleep, especially when it comes to getting less deep sleep. But chronic inflammation also impairs sleep quality and promotes wakefulness and fatigue through the night and fatigue during the day. The last two here are brain fog and memory issues. And our estrogen has a neuroprotective role, which becomes diminished. And then inflammation directly contributes to impaired cognitive function and memory recall and mental clarity. So again, inflammation and the decrease in estrogen and progesterone are all contributing to these symptoms. And the last one is weight gain and metabolic changes. We talked about insulin resistance a little bit, but even just weight changes. Declining estrogen affects our fat distribution and metabolism, and chronic inflammation, specifically with cortisol on board, promotes insulin resistance and abdominal weight gain. So the hidden inflammatory driver is oxidative stress. Oxidative stress is happening inside of our cells when free radicals, which are part of the natural breakdown of our cellular processes when we're trying to basically convert energy into ATP. Free radicals and antioxidants are basically like the kryptonite to each other. So when free radicals are floating around our cells, they lead to damage inside the cells and inflammation. And the answer becomes antioxidants. They stabilize the free radical and they reduce the cellular damage that the free radicals can cause. So free radicals will do all of these things. They cause cellular damage. They increase the release of cortisol. They impact that HPA axis and they actually activate it. So the free radicals will basically cause your hypothalamic pituitary adrenal axis to see the threat, and they cause increased cortisol as a response of that threat. So then elevated cortisol levels are sent out as a way of managing the stress from the cellular damage of the free radicals. And basically this causes a vicious cycle, and the chronic cortisol elevation creates more oxidative stress, which perpetuates the cycle over and over and over again. So what are the sources of oxidative stress inside of our cells? Poor diet, number one. Diets that are rich in or high in processed foods, refined foods, excess sugar, and are low in fiber are one of the most common sources of oxidative stress inside of our cells. Environmental toxins and pollution, chronic stress and lack of sleep absolutely lead to oxidative stress. And then excessive exercise without recovery in between. And then smoking and excessive alcohol. And, when you look at these things, some of these things are things that we don't have any control over. We don't have any control over the toxic nature of our environment these days or the pollution around us. We do have control over what we put in our bodies, on our bodies. We have control over managing our stress and improving our sleep. And we also have control over recovering and resting our bodies, and also our intake of smoking or alcohol. So as our declining estrogen levels, continue, that naturally reduces the body's antioxidant defenses as well. Like, I didn't realize how much I needed to be thanking my estrogen all these years, right? And so as our natural antioxidant defenses go down because estrogen is declining, it makes us more vulnerable to oxidative stress during menopause and during this transition. So we've got, it's not just the drop of hormone levels that causes these symptoms, but also our body's inflammatory response to the hormonal changes. Okay. So we've got hormonal fluctuations, right? We know that's happening. We've got increased inflammation because estrogen has that anti-inflammatory effect. The decline in estrogen allows the immune system to become more active and can actually lead to more systemic inflammatory response at the cellular level. And then we end up with this symptom manifestation. So this chronic low-grade inflammation directly contributes to the emergence of more symptoms, including more hot flashes, more joint pain, more brain fog, and more fatigue. So when we address that underlying inflammation, we actually can mitigate these disruptive symptoms and have a happier menopause experience. And this is just, again, the loop of menopause and inflammation. The sleep disturbances will trigger cortisol dysregulation, which worsens hot flashes. Poor sleep also drives cravings for more refined carbohydrates, which spikes blood glucose and adds to more inflammatory markers. This in turn disrupts the sleep quality and intensifies our hot flashes or heat intolerance. It increases the mood instability and increases joint pain. So breaking this loop requires interrupting it at multiple points. The good news is that you don't have to fix everything all at once. We can help, you can help yourself by changing small things along the way that actually reduce inflammation. For example, avoiding late night snacking and snacks with highly refined carbohydrates, that can actually help improve your sleep and reduces next day inflammation and sugar cravings. So there's things you can actually do to take action, which is the really encouraging news here. Now, this slide is going to answer the question of, well, how do we know how much inflammation we have? Take a picture of this slide if you can see it on your screen. The CRP level. This is my favorite biomarker. Biomarkers are here to give us information about what's happening inside of our body, right? So we can use things like blood pressure, cholesterol levels, blood glucose levels, A1Cs to understand our level of not only inflammation, but insulin resistance. CRP is like our next level, understanding our level of inflammation. So it provides some context, but it isn't the whole story. So your optimal CRP, which is C-reactive protein, is a useful biomarker for tracking systemic inflammation. Low risk for inflammation is when your CRP is less than 1, and that's a low risk for cardiovascular disease and inflammation. Moderate risk is when your CRP is from 1 to 3, and that's a mild elevation. And this is very responsive to lifestyle changes. This type of a CRP can be reduced very quickly within 3 to 6 months through strategic lifestyle interventions, including especially dietary strategy. And then your high risk is over 3, and that might involve significant inflammation in your body, but also could involve other types of intervention. But it's important to also know that CRP is influenced by acute infections, inflammation of fat tissue, metabolic health, any surgical or dental procedures you may have had, medications, and even the time of the day. So one single reading doesn't define you in terms of your elevation. In terms of your inflammation, but trends really matter here. So this would be something to monitor over the course of time, and especially as you're making interventions in your lifestyle to reduce inflammation. So, whoopsies. Oh my gosh. Sorry. Calls coming in. So now Courtney, this is the power to transform, right? This is taking understanding and turning it into action. Our bodies are designed to heal and adapt when given the right conditions. And, I've really been so humbled over the years to learn that these small, consistent changes in your lifestyle can create profound changes in your inflammatory state. And every meal, every good night of sleep you have, every movement that every workout that you do is an opportunity to support your body. And we're going to go over the 5 evidence-based levers that will give you practical ways to reduce inflammation, help to bring some balance into your hormones, and also reclaim your vitality during menopause and beyond. So they all work really well together, but you can even just start with just one. And so these are the 5 that we're going to talk about.
And I see lots of really good inflammation related questions in the chat, and we promise we will get to those at the end. So hang with us.
Yeah, we have some time for Q&A at the end for sure. So the first lever, and it's by far one of the most important things that you can take action on today. It is nourish your body with plants. Plant-based eating, the pattern of plant-based eating is one of the most powerful anti-inflammatory interventions available. And it literally starts in the grocery store. It starts in what you put on your plate. Build your foundation on your plate. Fill half of your plate with vegetables at lunch and dinner. Eat daily servings of legumes, any type of beans, berries, lots of herbs and spices, and, whole foods and particularly plant foods are so healing in terms of metabolic health and inflammation. And this is really one of the most powerful things that you can do for yourself. You can also start looking at strategic swaps on your plate or what you're bringing into your house, replacing ultra processed foods and added sugars with whole food alternatives, as well as if you've got refined grains coming into your house, maybe change them up for whole grains like quinoa or steel cut oats. Choosing beans and lentils instead of deli meats, and also moderate your alcohol intake. Alcohol is pro-inflammatory and it disrupts your sleep. And the best part about plants is that they have all the polyphenols, which are antioxidants. So you're going to get that polyphenol power to stabilize that oxidative stress, stabilize the free radicals, and reduce the oxidative stress that you have in your body, on a daily basis. So when it comes to antioxidant rich foods, I recommend aiming for 15 antioxidant rich foods a week. And also fiber. We can never underestimate the power of these fiber rich foods. Oftentimes fiber rich foods and polyphenol rich foods go hand in hand, and we want to celebrate them and eat them as much as possible. So you can almost think of food as information that shapes your metabolic terrain. The second lever you can pull is balancing your metabolism with timing. And the timing refers to meal timing and also your fasting window. So when you eat can be as important as what you eat. And there's lots of meal timing strategies that support metabolic health and reduce inflammation. In fact, in some studies, they've shown where people have changed nothing else but the timing of their eating window, and they've reduced inflammation. They've been able to improve things like their A1C and weight loss and things like that. So there's lots of studies out there about timed eating as an intervention for balancing your metabolic health. So this means that you're eating your consistent meals at consistent times of the day. Extending your overnight fasting window. So maybe aiming for 12 to 14 hours of overnight fasting. So starting from 7 p.m. to 9 a.m. And that could be really helpful in terms of really the cellular repair that's happening inside of your cells. And then starting your day with lots of fiber-rich foods to reduce cravings and stabilize your glucose and lower inflammation. And the last thing is to limit late night eating, close that eating window at least 2 to 3 hours before bed to improve your sleep quality and your metabolic health. And just of note, time restricted eating may not be appropriate for everybody. So something to think about if you are considering time restricted eating, consult your doctor if you're taking medications for diabetes, or if you have a history of disordered eating or are pregnant or breastfeeding. Lever 3, sleep like it matters. This one is a non-negotiable. Sleep is foundational to our inflammatory control, our hormone regulation, and symptom management. Poor sleep will actually derail next day cravings, basically causing more cravings. It worsens insulin resistance and amplifies hot flashes and mood instability. So we want to aim for 7 to 9 hours of nightly sleep with a consistent sleep-wake schedule, even on the weekends. Keep your bedroom cool. Studies have shown that keeping your bedroom at 65 to 68 degrees Fahrenheit is actually optimal for promoting deep sleep and regular sleep cycles. Keep your room really dark, get some blackout curtains and quiet. Creating a light curfew for yourself where you dim your lights 1 to 2 hours before bed and also avoid screen time. That's a really great practice to start to turn down the light coming into your eyes. It actually helps your brain shift into that bedtime and sleepy time state. Also, time your caffeine. Maybe consider not drinking caffeine after 2 p.m. if you notice that it's keeping you up at night. And participate in a wind down routine, meaning get 20 to 30 minutes of calming activity, reading, gentle stretching, or some meditation before bedtime. That can make a really big difference in how deeply you're sleeping through the night. Lever 4 is move more and lift strong. So movement. It is medicine during menopause. Regular physical activity improves your insulin sensitivity, preserves bone density and muscle mass. This is so important for reducing your risk for osteoporosis. And it also reduces inflammation and helps your mood, helps you feel better, right? And your cognitive functioning. So aiming for, cardiovascular exercise, 150 to 300 minutes per week. We want to break it into manageable chunks, even just 10-minute sessions of working out is really important. Brisk walking, cycling, swimming, these things are really powerful. And even if you can get out every day for, 10 or 15 minutes for some brisk walking, that's a great way to increase your cardiovascular exercise. Strength training is another really important part of our wellness for our bone health. Our bones are depending on us doing strength training and adding resistance training, whether it's body weight training or body resistance workouts or weight training 2 to 3 times a week is really great for muscle mass, bone density, and our metabolic health overall. And then the last thing would be sort of introducing movement snacks into your daily routine. So if you're sitting for 30 or 60 minutes at a time, take a break, go outside, get a walk, do some stretches at your desk, maybe do some stair climbing. Taking moments of the day to do brief little movements is a really great way to improve glucose regulation and reduce inflammation. And the last lever is to calm the cortisol. Chronic stress will amplify your inflammation and disrupt sleep and worsen your menopausal symptoms. So some daily micro practices that you can start introducing would be breath work. So taking 5 to 10 minutes of diaphragmatic breathing, activating your parasympathetic nervous system is one fantastic way to calm your cortisol levels. We also want to build in mindfulness practices, right? Add in some meditation or body scans, especially before sleep. It's a great way to get your parasympathetic nervous system activated and get you into that relaxed state. And it also reduces cortisol levels. Get outside in nature, participate in some outdoor activity just for 10 or 15 minutes a day. Get that sunlight in the morning to activate your sleep hormones, and go do some grounding or walk in some woods. It helps with lowering stress biomarkers and enhancing your mood. And then don't forget about your social connections. Have meaningful relationships in your life that actually help to, debrief the stressful events of your life. You've got friends or family members that you can share things with and maybe get some feedback on. It actually helps you to protect your energy by having those relationships. And also, don't forget about rest days and restorative practices. These are not indulgent. They're actually strategic interventions that allow your body to adapt and heal. So if you want to take a picture of this slide, this is your 5 anti-inflammatory levers, the sort of quick reference guide here. So just in case.
And we will have it on YouTube too. So don't panic. Okay. If you can't figure out the screenshot, it will be available. but yes.
Okay. Yeah. This is just a summary of everything we just talked about. Okay. So a few somebodies have asked about hormone replacement therapy. So where does that fit in, right? If we're going to talk about lifestyle and we're going to talk about, hormone replacement therapy, somewhere there's a balance for everybody, right? So it can be a valuable tool for some people, but it's definitely not a substitute for lifestyle interventions. So the first thing to start thinking about is how can I actually work on my lifestyle interventions first? And by understanding the evidence, making these informed choices with my doctor, right? So, when we look at the bigger picture of hormone replacement therapy, ultimately what it's doing is replacing the decreasing hormones in your body, right? The estrogen and the progesterone. The timing of this matters. It offers the best risk benefit profile when initiated before age 60 or within 10 years of menopause onset. Okay. So early intervention does support cardiovascular and bone health, and there are studies to support that. It also can actually help improve vasomotor symptoms like hot flashes and night sweats. And it can improve sleep quality as well and preserve bone density. And certain ways of taking hormones can actually be better than others. So for example, transdermal estrogen, which are either patches or gels, is metabolically neutral or even favorable on CRP levels, while oral estrogen that you take as a pill or a capsule tends to raise some inflammatory markers. So again, the type of your dosing or the route that you're taking it does influence the risk profiles. So again, if this is something that you're thinking about, or you're thinking about, maybe your doctor's even talked with you about adding in hormone replacement therapy, it's something to also ask your doctor about lifestyle interventions, right? And also understanding your biomarkers for inflammation. I don't think there's any one size fits all approach for any one person, for everybody, right? And I've seen that over the years of working with people on incorporating more lifestyle tools. So when it comes to hormone replacement therapy, it's something that should be used alongside of, but not instead of those 5 lifestyle levers. So focus the focus should be as important on those lifestyle interventions as the symptom relief from the hormone replacement therapy. Because even with optimal hormone therapy, inflammation and metabolic health would still be underlying in your body and can still lead to things like insulin resistance, elevated blood pressure, elevated risk for things like high cholesterol or heart attack and stroke, right? So even with the best hormone replacement therapy, you're still at risk for other things that lifestyle interventions can help you reduce the risk for. So what I've seen over the years is that sustainable change happens through incremental progress. We're not talking about overnight transformation. So those 5 levers that we talked about, we want to phase them into our lives. We don't want to just all of a sudden wake up tomorrow and be like, okay, I'm going to go to the gym and do this, and I'm going to eat this way, and I'm going to, do all of these things all at once. Take it slow, make one change at a time. Notice the difference you feel in your body, right? Pick one lever per week to build adherence. So maybe during weeks 1 and 2, you're creating a foundation of plant-forward foods and swapping out the foods that are really inflammatory in your dietary strategy right now. Maybe you're adding more fiber. You're adding more antioxidant-rich foods. Just focus on adding more of those things in, and then establish a consistent bedtime and wake time so that you work on sleep as well. Maybe weeks 3 and 4, you move into the movement and stress response and layer in some strength training or some daily walking along with some breath work. And then track your progress, monitor your symptoms. You can rate them. You can, note how many hot flashes you're having per day at the beginning, and then notice if they change after 3 or 4 weeks. Notice your sleep quality, notice your energy levels. One of the first things that people say to me when they start eating more plant-based diet, or when they start eating more plants in their diet, is they start noticing their energy is better. So, alongside of the biomarkers that you may be monitoring, you can notice how you're feeling, and also just even counting the number of hot flashes that you're having in a day. So here's an actual example of somebody that I have worked with. The baseline, basically, she came to me with frequent hot flashes. She was having 8 to 12 hot flashes per day. Her CRP level was 3.8, which was a high inflammatory burden. She had fragmented sleep, maybe 5 to 6 hours per night on a good night. And she was suffering with things like fatigue, mood instability, joint stiffness, all the things that we've talked about here today. And she also had a diet that was high in refined and processed foods and added sugars. After 8 weeks of intervention and working together and coaching strategies, her diet changed to a plant-powered dietary strategy with daily legumes, berries, and especially leafy greens, lots and lots of leafy greens. She started using a 16-hour timed eating window. So she would eat while she was eating between noon and 8 p.m., fasting between 8 p.m. and noon. She participated in strength training twice per week and daily 20-minute walks. She started introducing a breathwork practice of 5 minutes per day. And it was sometimes when she was driving in the car. Sometimes it was, before bed, but just 5 minutes daily of breath work. And she built a consistent sleep schedule with a wind down routine. And her results were amazing. She had a 70% reduction in hot flashes. She went from 8 to 12 per day to 2 to 3 per day. And the intensity also decreased. So the 2 to 3 that she was having weren't as significant. She ended up with a new CRP level of 1.6. So she had a huge improvement here in her general overall inflammatory marker. And then her sleep duration, she started sleeping really nicely, 7.5 hours of sleep. She was waking up feeling rested. She wasn't getting up multiple times through the night with the list of things on her mind. So this case really illustrates the cumulative power of just subtle changes but consistent lifestyle changes, right? We changed a few things in here to help her gain control of her symptoms and her experience. And she was moving her body in so much better. Like that was the other thing. She was like, I feel really great to go do my strength training and do my weight training. She was working with a trainer and she was like, I was expecting my body was going to feel really bad and it felt better and better. So it's a really exciting sort of real world example here for you. Okay. I'm going to skip ahead of that one. And, I'm actually going to move a little bit faster through these because I think this is a little bit of I want to be respectful of everybody's time here, Courtney. And it gets us some questions. But the recommendations that we're talking about here are really grounded in robust clinical evidence from endocrinology, nutrition science, and menopause medicine. So the key areas of research include diet and inflammation. And we know that plant-based diets are consistently reduce CRP levels and improve metabolic health. The practice of time-restricted eating or extending your fasting window improves insulin sensitivity and reduces oxidative stress and lowers inflammatory biomarkers. Exercise and menopause are so crucial for building strong bones and preserving your lean body mass so that you have strong bones to reduce your risk for osteoporosis. And then stress management and cortisol regulation. There are so many studies that show that mind-body interventions like meditation, breathwork, and yoga have been shown to reduce cortisol levels and inflammatory markers for all people, but especially in menopause. And here are just some resources and references that I was using to help develop some of this, but there's lots of studies out there. There's also often I hear common concerns, and maybe this will answer some of your questions that you have. And one of them is, what if I can't do all 5 levers? What if I can't do all of these things at once? And the truth is you don't have to implement everything all at once, right? This is not all or nothing. These levers do work synergistically, but just addressing 1 or 2 of them consistently will get you measurable improvements. So you want to start with the thing that feels the most accessible. So if sleep deprivation is your primary issue, focus in on that first. Set that bedtime routine, work on your sleep hygiene. If you're already active, but you're eating poorly, prioritize your nutrition. So build on your small wins rather than pursuing perfection. And most women can see meaningful symptom reduction and CRP improvements within 4 to 8 weeks of addressing just 2 to 3 of these levers consistently. And I will tell you that the food is going to get you significantly the highest results. The answer comes in the food. Wow. If you're noticing your CRP isn't changing after making lifestyle changes, you may want to talk about potential undiagnosed conditions with your doctor. Look at your metabolic health or excess visceral fat, what's happening there in your body. You could look at the side effects of certain medications, which can influence CRP levels. And then also some genetic factors can influence elevated CRP. So definitely if you're not seeing the change in that level, you may want to increase some of the lifestyle changes or interventions, increase the levers, but also talk with your doctor. Another concern is about social events and celebrations, and this is one of the things that we've got to just give ourselves some grace sometimes and just know that you can always come back to your strategy. Maybe it's about strategizing your day before you're going out for a late dinner, maybe making mindful choices at events when you're at an event, making choices that are rich in fiber, moderating your alcohol intake. But just remember, one meal or evening out won't derail your progress. What actually really matters more is that you have a pattern that you can return to the next day. Give yourself grace, give yourself flexibility. These are essential components of long-term sustainability. And I like to think about it as and Courtney, maybe you can relate to this, what would you say to your best friend? Right?
Don't be so hard on yourself. Yeah.
Exactly.
Yeah.
So, if you have any chronic conditions and you're looking to make lifestyle changes, it's always a good idea to talk with your healthcare team, monitor your symptoms, monitor your biomarkers, modify the intensity of the things that you're doing, especially if you have any limitations cardiovascularly, work with a trainer that really understands how to help you with whatever chronic condition you're living with, and focus on the things that you can control that are in your hands. Like I said, even modest improvements in diet quality or your food quality, the sleep or stress management will produce meaningful benefits. So, action plan. Building a personalized action plan. You're going to assess your starting point, and that starts today, right now. Courtney, we can talk about that. What is your starting point right now? What micro lever goal are you or what micro goal do you want to change per lever, right? Maybe you want to add one vegetable per day, go to bed 15 minutes earlier, take a 10-minute walk after lunch. These practices build up over the course of time, right? Schedule your goals, schedule the activities that you want to participate in, put it on the calendar, and then keep reviewing and refining, every 2 to 4 weeks, assess your progress. What is working? What feels unsustainable? Adjust it and change to make it work for your lifestyle. And, when it comes to long-term sustainability, mindset matters, and it requires more than just the tactics. It's important to think about how you relate to your body, your health, and your self-care. So remember, progress, not perfection, right? We want small, consistent actions which compound into transformative results over time. Rest and recovery are not rewards for productivity. They are essential components of health and resilience. It's another great mindset shift. And the last one is you're not broken. Your body is responding normally to the signals that it's being sent. So change the signals and you change the response. These are some really great mindset shifts around how you can approach some of these lifestyle changes. And just again, remember to cultivate self-compassion. Setbacks are inevitable and they're also informative. They reveal opportunities for problem solving and for redirection, right? So I like to think about it as trial and learning. There's no trial and error or trial and failure. It's trial and learning. We learn, we grow, we do new things. So the question is, what's one lever that you can start today, now, right? What's the one deliberate action? Which one of the levers do you want to push today? I am happy to take questions. I'm sure you must have a million in the chat box.
Yes, we are going to get to as many questions as we can. There's so many good ones. And speaking of levers, though, I wanted to share first. So we're coming to the close of the presentation. We will get to all your questions, but first I wanted to share a special deal that would help you with one of those levers. We have Forks Meal Planner, which is an amazing tool that helps kind of put that healthy eating lever on autopilot so that you don't have to think about it. Forks Meal Planner has over 3,000 recipes in it, and many of them are exclusive and not available anywhere else. And it's just a great tool. Kylie, you're familiar with the meal planner. You've used
Absolutely.
it. Yes,
Absolutely.
It's
Fantastic.
I love it. It's such a great. The app is great. It has this weekend prep function, which kind of tells you what you can do on the weekend to simplify meal prep during the week. It just puts it all on autopilot and makes it really simple. And as you said, diet is the most kind of important. If you're going to pick one lever, it sounds like you would say diet is the
Absolutely.
one.
Yeah.
But But yeah, so it can be overwhelming. Sorry, you were going to say.
I was going to say that absolutely, Forks Over Knives has such a great system in place where you can go. It's like your one-stop shop for what to put on my plate. What do I make? How do I grocery shop? If you're looking for food choices and meal prep, this is the solution for sure.
And it's so healthy. I mean, everything is it's designed to be health promoting and to reduce inflammation, to help with weight management. I mean, every single one of these metabolic issues, it's going to help you with. And so yeah, it's a really great tool. And right now, I just wanted to let you all know, I wanted to ask first if I could tell you guys about a special deal. If you could just drop a yes in the chat. Otherwise, we can just skip this and end the webinar. But if I see some yeses in the chat, then I will share our special deal for today that we have for all of our wonderful webinar attendees. We see we've got hundreds of you still on with us.
Yeah, so many people here.
So if I have your permission to share, yes, I see Robin. Yes, Jackie. Yes,
yay,
awesome.
Yeah,
wonderful.
Definitely want to know about this deal.
Great. So the meal planner, typically the monthly cost is $7 a month. But if you go for the annual plan, it's going to only cost you $49 a year, which is a savings of 42%. And so really, if you think you want to eat whole food, plant-based, for more than a couple of months, it's really worth it to go for the annual. And not only does it save you money, but also you have a year's worth of whole food, plant-based meal plans coming your way. So you can just feel really confident that you're going to stay on a healthy path with your diet. And there's a 14-day money-back guarantee. And we have all these exciting new features coming out. We have Instacart integration in addition to the Amazon Fresh integration we already have. So you can kind of just put everything on your shopping list and then buy it all through Instacart if you would like. We'll be rolling out a feature where you can import your own recipes if you would like into the collection. But yeah, it's normally $6.99 a month, but we have it. You can get the whole year for just $49. And again, there's a 14-day money back guarantee. So if for some reason you don't like it, you can get your money back, but I guarantee you will like it. I have turned many friends and family members onto it. And the exciting part tonight is that anyone who buys an annual plan tonight will get free shipping on Forks frozen meals. I don't know if you've tried, we have a new line of frozen meals out there. They're really, really good. I've tried them myself. It's a delicious, like cheesy mac and cheese, not real cheese, broccoli. They're oil-free, super healthy, heart-healthy meals and really tasty. And so if you buy a Forks Meal Planner annual plan tonight, we will send you a special code so that you can get free shipping on a Forks frozen meals order. But you do have to buy tonight for that. And so you're going to see on the right side of the screen here, there's a link that Kylie has added, and that will take you to the meal planner page where you can purchase that annual plan or monthly. If you are feeling more of the monthly, you can always do that too. And you won't get the free shipping on the Forks frozen meals, but it's still a great investment in your health. And I really love the meal planner. It's a really great app.
Absolutely. It's so easy. I love the features that you can like build your shopping list and just like you can take stock in your home of what you have and what you need to add to your list. It's so convenient to use. I absolutely love this app. And, the recipes, they're so easy to make. They're things that they're going to feel familiar in flavor, in the flavor profiles. And, to your point, if you're going to work on one of the levers, give yourself the best tools to move that lever, right? And if the food is the thing that is going to bring you the most overall benefit when it comes to the anti-inflammatory lifestyle, by adding more fiber, by adding more antioxidants, that's how you're going to do that, is through the food. And what Forks Over Knives has done so beautifully is put the food forward and food first. And it could not be an easier solution really when it comes to pulling that food lever.
100%. And I edit all these wonderful success stories, and we hear from folks who have signed up for the meal planner and have ended up lowering their levels of inflammation. Losing weight is obviously a huge one. And even seeing relief in menopause symptoms. It has a really tangible result. And I just received word. I misspoke earlier. I said you had to buy the annual plan to get the free frozen foods shipping code. Actually, if you buy at any level, even monthly, today. And Jackie, I saw your question. Yes, you can do it later tonight. It is only the contiguous United States. I'm sorry.
Oh,
Amber in Alaska, but yes, contiguous US will take care of your frozen food shipping cost if you purchase a meal planner today at any level. So yeah, I was excited to share that with you. Okay, now as promised, we have so many great questions here. It's been hard keeping up with them and great feedback. I want to tell you that, Kylie, people have been saying this is the clearest explanation of inflammation they've seen or the endocrine system that they've heard yet. So really great value that you've provided for all of us.
Thank you. I'm so glad to hear that. Isn't it wild that here we are in our, fourth, fifth, sixth decade of life, and we're just now really getting the understanding to support our bodies. And I've worked with so many people, and there's no wrong time to start caring about what's going on in your health. Today is the right time. Today is the best time. So, we can absolutely make changes. It's very easy to make. And actually, I mentioned this earlier. When I was working in my traditional healthcare role inside the hospital system and healthcare system, one of the things that frustrated me a lot was that there's this sort of like fear of asking people to make changes in their lifestyle, right? Like, well, we can't ask them to change their diet. That would be crazy. But let's just, do all these other interventions.
Right.
And what I've learned here is in my work as a coach is that people are so willing and motivated to make change when they have the right information at the right time. And so maybe for you coming tonight to this webinar, you're seeing that this was the right time for you to hear this information or get this information, to take action, to put the power of your health in your hands. And that's one of the things that's it's been so powerful for me. And I've just loved being a part of that for people. So, and I agree.
Yeah, I was going to say there is an issue where a lot of physicians in traditional medicine think, that people aren't going to change their diets, but people really are willing. And that actually brings up one of the questions I saw in the chat. There were a couple folks asking, how can they find a physician who supports a lifestyle medicine approach? What resources would you recommend?
Oh my gosh. Absolutely. There's so many great resources. One is called Lifestyle Telemedicine. They have physicians that are licensed in all 50 states, and they can do telemedicine. And it's a great way to connect with a doctor who really understands these influences of lifestyle. Like, they're going to talk to you about eating more food, more fiber-rich foods, more antioxidant-rich foods. They're incredible. And then also putting together the bigger picture. So again, there's no one size fits all approach for everybody. There are medications that are really beneficial to take. And this isn't to say that no medication should ever be taken. Same with hormone replacement therapy. Again, I'm married to somebody with dysfunctional pancreas. So I love hormone replacement therapy in my house, right? But when it comes to, again, adjusting our lifestyle along with the medication, sometimes the medication can be a Band-Aid for a bigger issue. Sometimes certain medications can be a support and a tool to help you get motivated to move forward, right? And if that's what it takes, then maybe the medication is beneficial in the short term. But there are no medications to cure inflammation. There's not one medication out there that's going to cure inflammation. There's not one medication out there that's going to cure insulin resistance. It does not exist. So if you want to really get control of your health at the bottom of it, the lifestyle interventions have got to be the other more powerful half of that equation with the medication, right?
Absolutely. And speaking of inflammation, a bunch of folks were wondering, how do you measure your inflammation? How can you go about getting a test? Is that something you ask your primary care physician for a test of?
Absolutely. At your next routine lab work, you can ask your doctor for that test and just say, I'm concerned about inflammation in my body. I'd like to learn more about my risk for especially cardiovascular disease. In my opinion, I believe that CRP should be one of the biomarkers that's measured on annual screenings at our regular routine lab checkups. And most doctors are becoming more and more familiar with it, especially in the cardiovascular space. But yeah, absolutely. Ask your primary care physician, talk, if you are going to be looking for, lifestyle medicine physicians, there's databases as well. I know that the American College of Lifestyle Medicine has a database of plant-based doctors that are in practice all around the country and all around the world. You can find specifically a lifestyle medicine provider but you can also work directly with your own provider. And I'll tell you, a lot of doctors are really impressed and surprised when their patients come to them and say, hey, I'm trying on some lifestyle changes, right? I'm trying to eat more fiber and eat more antioxidant rich foods. I'm trying to reverse my inflammation. Can you help me understand what's happening in my body through a CRP test? They would probably be very happy to partner with you, right? So most doctors are going to want to help you understand your body. It's just not part of the routine testing or screening at this point. The way that like cholesterol levels and kidney panels or liver function studies are routinely ordered as a part of the routine doctor's visits, right?
Absolutely. And we have a couple people in the chat have mentioned that they have had hot flashes and night sweats for years and years. May said 19 years. I've seen what advice do you have for people in that position?
I mean, honestly, in that situation, like I would definitely work on the interventions that you can take at night. So cooling your room, putting a fan on, especially if it's nighttime, if you're having like nighttime experience, sometimes even just like changing your clothes overnight, changing some pajamas if you're sweating through your clothes, just to optimize your comfort as much as possible. If you are having this extensive amount of hot flashes, what I would say is start looking at the inflammatory marker, like get your CRP checked, start looking at the interventions that you can take at home. Are you exercising? Are you doing weight resistance training twice a week? Do you have daily movement practices? Like just really take stock of your full lifestyle and be really honest with yourself, right? This is not a time we're not trying to fake anybody out here, right? Like, be really honest with yourself about what is really coming in. Start writing down and logging your food. Food logging is one of the best gifts you can give yourself in terms of understanding what is really inside of your food. Look at things like how much oil is in the food that you're eating. Lowering your dietary fat is one way of, sorry, I'm like giving myself a bubble here. Lowering dietary fat by refined oils, things like that. Refined sugar is a huge...
oil was the question in the chat as well. Someone asked what impact oil has on inflammation.
Highly inflammatory. Literally, it changes your blood vessels upon eating it. Having oil in your diet, take out oil. If you're struggling with the hot flashes, take out oil for a week and see what happens. If you can get the oil and sugar out just for a week, and again, this is from specifically refined foods, but not even really refined, cooking oil. Oil is highly inflammatory. And actually the recipes in Forks Over Knives are all, as far as I know, are all oil free.
Yes, 99%. We have introduced Forks Flex recipes where you can optionally, if you would like, add a very small amount of extra virgin olive oil generally. And that's just to kind of make it more accessible for folks who are coming in just wanting to eat more plant-based and thinking like, wait, oil for, it seems like maybe a bridge too far. But we are vastly, for the majority, oil-free, and we really recommend that, especially when you're trying to address symptoms and if you're concerned about your cardiovascular health.
Absolutely. And again, kind of like to reiterate this fact that as estrogen levels are lowering in our body, that puts our cardiovascular disease risk it almost like throws it right out front and center, because estrogen over the years has had the cardiovascular protection, has offered us a level of cardiovascular protection. And so all of a sudden you drop down that protection with the estrogen level dropping, and now you're at higher risk for hypertension, higher risk for increased cholesterol and heart attack and stroke, right? That's the ultimate end result of heart disease and cardiovascular disease. And so, when it comes to really thinking about this whole picture altogether, the more interventions you can take for yourself right now in your home, dropping the oil out is going to improve your cardiovascular. Not only could it improve your hot flashes and the experience you're having there, but it can also improve your heart disease risk, and you're lowering your risk to develop a heart attack or stroke, and helping you to live the longest that you possibly can live in the best way possible.
Absolutely. Yes. Heart disease is sadly the number one killer of women. It's a huge epidemic, and the symptoms don't always present in obvious ways in women. So it's really something we need to address at the source. Weight management. You talked in your presentation about the abdominal fat that seems to come on so stubbornly for a lot of women who are in menopause. And Jackie asked, she said, I'm 54, done with menopause, plant-based. I can't lose weight. I tried to eliminate sugar. What advice would you have for somebody who's having trouble with weight loss while on a plant-based diet?
Okay. My other favorite lever. So the food is my favorite lever. My second favorite lever is the timed eating. Develop an intermittent fasting practice. And I would say daily 16/8 fasting is one of the best things you can do for lowering inflammation in terms of cellular cleanup, because when you're not digesting, when your body is not, there's so much work that happens in your body when you're digesting food, and hormone responses and all these things that are happening to get that food turned from food that you eat to get all the nutrients out of it through your digestive process. So when you are not doing that, your body has so much more time for cellular repair and cleanup of that debris and reduction of inflammation, right? So for you, what I would recommend in this situation is develop a daily 16/8 practice of fasting. So set an eating window of 8 hours, and the other 16 hours of the day, you just have kitchen closed, right? Not eating. And the reason this works is that it allows your body to develop very consistent routines. It's bonus points if you can eat at the same time every day. That's like second level, second tier. First, develop the 16/8, then start eating at the same time and 2 meals a day. First of all, it simplifies your life. Just eating 2 meals a day does simplify life. It naturally will reduce some of your calorie intake, and it allows that cellular debris cleanup around that adiposity that's happening with that in your abdomen, that stubborn abdominal weight. And you can start to see changes in the scale pretty quickly. Most people who develop a 16/8 fasting practice, in my experience, have been able to consistently lose 1 to 2 pounds a week. And especially in collaboration and coordination with lever number 1, which is the plant-based food. So you can consistently lose 1 to 2 pounds a week of that stubborn weight. And I have seen women at all, again, I'm talking 50s, 60s, 70s, 80s, achieve the health that they've always dreamed of by implementing some of these tools.
That's amazing. Yes, it's so fascinating about the timed eating. I was watching a video that Dr. Michael Greger had about some studies with that recently. It's really fascinating how that relates to our metabolisms. And so Tammy had a question related to HRT. She was wondering if post-menopause, well, first off, is there a post-menopause, or is menopause kind of for the rest of
menopause is it? Yeah. You're
it's
like,
forever.
You've hit that 12-month window where you've not had a cycle, and then you're like beyond menopause. I don't know. We have to rename. We need to rebrand that.
We need some more terms. Yeah.
Yeah.
Well, okay. So anyway, Tammy says post-menopause is HRT an option, and that older studies kind of scared us about the HRT cancer risk, but newer data is finding that wasn't quite accurate, and those studies were flawed, and the risk seems very low. And so would there be benefits? You did touch on this in the presentation, I believe, but could you speak to that about post?
Sure. Yeah, postmenopausal HRT. What I was saying was the research is showing that like up until age 60, it's generally deemed within the within the indications to start HRT. After age 60, it's probably up to the discretion of the provider. And that would warrant a more vigorous conversation with your doctor about the benefits of it, the risks, the side effects, especially when it comes to what symptoms you're trying to mitigate, right? If there's specific symptoms you're looking to resolve, using the HRT in combination with some of the lifestyle factors could actually be your best approach, right? So it's like, what's good, what's better, what's best. The best approach would be combination of the two, right? But the standard understanding is up until age 60. Now, I do have to point out, just because it seems like we're probably in a whole group of women here, women were left out of medical research until the 80s consistently. So, some of this information, like you're talking about older studies and newer studies, truly, we are finally getting represented in medical research. We're finally getting represented in medical trials. I mean, it's really hard to know, we're basing this on the best information we have at this moment. And so really having a deep conversation with your doctor about what your goals are, what you're trying to accomplish, what symptoms you're trying to resolve, and if a medication or a hormone replacement therapy is the right fit for you in combination with these other types of strategies, right? So
it's not an either or, it's a combination strategy.
Yeah. I hope that answered that question for her.
I think so.
Yeah.
So,
I see a question here from Monica.
Yeah, go for
what
it.
if you feel hungry at night? I love this question.
Yeah.
Especially around the timed eating window, right? Like if you're having that timed eating, where you're fasting during the day and then you're feeling hungry at night, this is your green light to eat more fiber-rich food during the day. If you're feeling hungry at night, if you're like eating dinner after dinner and you're actually having actually I should really start by saying, is it true hunger or is it emotional eating or is it sort of habitual eating? Because those are two very different things. Okay. Pure physiologic hunger comes from deficiency in calories, right? And energy, having a lack of energy or physical, and not energy that you expend, but energy that you take in, right? So what I would offer to you is to really do some deep reflection on what is it that's happening at that time of the night. Is it that you're bored? Is it that it's just your habit to snack with a movie in the evening hours? Or is it that you would benefit from adding more fiber-rich foods during the day to make sure you're sort of carb loading in a different way, eating up front during the day. So that way at the end of the day, you feel satisfied and not reaching for any food or snacks at the end of the day.
And on the opposite end of the weight question, someone asked about the relationship between low body weight and hormone disruptions.
That's a really good question. And if you are somebody who is either underweight or just low in your body weight, calculating what your ideal body weight looks like, I think is a really good place to start, because there is an ideal body weight that is a very simple calculation based on your height. And I think some people feel that they're underweight when they're actually closer to their ideal body weight. So first you can do a simple Google search for calculating your ideal body weight. But if you are actually underweight, then, hormone influence can be more significant. Now, ideally, your body would adjust your hormones on your body weight. So it's not necessarily that it would be better or worse, but if you have an underlying condition that is causing you to be underweight. So for example, people who have decreased insulin production often find themselves becoming underweight because they're not able to take on the glucose and they end up like basically can't keep weight on, right? So if there's something that's causing you to be underweight, whether it's a lack of low calories or some other physiologic issue, addressing that first and then working on the hormonal balance would be important. But if you're underweight because you're under consuming calories, that can absolutely influence your hormonal, how your brain is actually balancing your hormones. And one example of that I can come up with right off the top of my head is that I worked with teenagers in a pediatric unit, and many of them were coming in with anorexia. So they were very underweight. And what happens when you're underweight is that your brain actually goes into a protective mode and it turns off the non-vital functions. So it actually lowers hormones. So oftentimes one of the first signs of anorexia is a disruption of menses. So menstruation goes away. And the reason for that is that your brain biologically is like, well, we don't need to reproduce right now. We're under a lot of stress. We are undernourished. And there's a true biological reason why your hormones will be adjusted at that point. So they actually turn off menstruation so that you're not able to reproduce. So that's all hormonal. And that's all because the body is under such high degree of stress from being so underweight. Okay. So again, addressing what is causing you to be underweight, if that's truly, or if you have a lower body weight. If you just naturally are a smaller framed person with a low body weight and you've never had disruption of other types of your normal hormonal cycles, like menstrual cycles, then it probably isn't necessarily going to show up in menopause as a problem. I hope that helps.
That makes sense.
Yeah.
That totally makes sense. I see a question about protein. Can you get enough protein on a plant-based diet? It is related because protein, as we know, becomes even more important as we age, right? For muscle mass and all that. So could you speak to that?
Absolutely. Yes. It's actually quite easy, especially when you focus on fiber. I've done a lot of food logging and developing recipes over the years and like really putting together well-balanced recipes. And one thing that I learned is that the more fiber you eat, the more protein you get. It's like almost gram for gram, with the exception of fruit. Vegetables, starchy vegetables, legumes, when you focus on the fiber from those foods and whole grains, those foods, the fiber to protein ratio is almost like, it's very close. They're very, very close. They're the closest compared to any other of the macronutrients. So if you're going to start working on, and by the way, it's also very easy to meet and exceed your protein needs from a plant-based diet. It's a well-constructed diet matters. But I had a very healthy plant-based pregnancy, and I was able to exceed my protein needs every day by the simple, by making sure I was adding the foods in at the right time. But food logging really is important. And I think if you don't know how much protein you're getting each day, start food logging. Start logging what you're eating. Get an idea, because unless you're logging it, you don't really know. You're just guessing how much protein you're actually getting, right? So log how much protein you're getting. It is important that as we do age, and they say like over 65, we should get up to 15% of our total calories from protein each day. Most women under 65 generally need somewhere between like 45 to 55 grams of protein per day, closer to 45. But if you're somebody who's not very active or not doing weight training, protein isn't as vital of a nutrient. I mean, it is important, but if you're doing more weight training, then you might want to increase your protein above that.
Got it. And for logging the food, are there any apps that you would recommend or other tools?
Mm-hmm. Yeah, I love Chronometer. Anybody else here love Chronometer as much as me?
Chronometer fans in the chat.
Talk about Chronometer all day.
I don't know Chronometer.
Are you serious? Oh my gosh.
No.
So much fun. They have been around. They've been around for years. They are so great. I have been using it since 2016 with my clients. They have the most up-to-date science-backed nutrition data. They're constantly updating their features. You can now scan. They have like a scannability. You can scan food, which is nice on the app. That you can set and you can log and trend your biomarkers, like all your biomarkers you can put in there. It's just a really great app, and it's very affordable. There is a fee. There's a free version, but the yearly annual membership does a really nice job, and it's a pretty affordable investment to learn exactly what nutrients you're getting from your food.
Great. Let's do a few more. I know we're running. There's so many good questions.
I know.
I've seen a couple of folks are asking about supplements. I know there are so many supplements being sold for every condition, but especially hormone health and menopause. So what are your thoughts on that?
Oh my gosh, it's so confusing. I know, you guys, like I'm in it too. Like I said, I'm 46. Like I'm right in this phase. Like it's happening. It's going to happen soon, I think. I don't know. And I'm seeing it. I'm seeing it all. Like my social media knows me. They're like, you're 46. You need these supplements. So I totally get it. And, when it comes to supplementing, again, what really matters is what problem are you trying to solve? And when you log your food, you can see what nutrients you're already getting from your food. And that's one of the most powerful things about food logging, because a lot of supplements are nutrients like minerals and vitamins that you're getting from your food. And if you're already getting those things, then you may not need to supplement at all. And again, I would definitely consider talking with your healthcare provider about any supplementation, because monitoring, if you are supplementing with either vitamin or nutrient supplementation, you may want to monitor your levels as well, your blood levels. When it comes to specific hormonal or specific supplements, if it's not a food, like for example, there was a period of my life where I was doing some seed cycling when I was working on my fertility, and it was all seeds. It was food. It was whole food, and it was just all about like eating certain seeds at certain times of the month. Okay. And that felt very aligned for me. That didn't feel like I was supplementing anything, but it felt like I was giving myself specific nutrients at specific times of my cycle. Okay. So that's one strategy. But if you're looking at supplements that have things like added sugar or ingredients that you don't recognize, do the best research you can. Make sure you're getting it from strong evidence that really supports why to use those types of supplements. We do use some supplements. We use some protein powder in our house. We definitely supplement with things like vitamin D and B12. We supplement with, I have like a ground mushroom antioxidant blend that has like spices in it that I like to put in my coffee. So there's things that you can do that are supplements that are food related, right? Mm-hmm. So that's where I tend to lean. Again, my personal preference. But I would say exercise caution. Like the people who are selling you supplements should have some credentials behind their name. They should be talking about it from a scientific and a cellular level as to why that supplement is benefiting you. And these should be people that are going to talk about the science and not try to, kind of bait you in with a sale immediately. That would be how you could discern who to trust.
Great. That's very helpful. Okay. One more question, because it's an important question from Jean earlier. She said she's been struggling with a lot of stress and anxiety. Even though stressors have long passed, she can't let go of that feeling of stress. And she has a feeling that her hormones are out of whack. Do you have any advice there?
Yeah, absolutely. I mean, first and foremost, trust your intuition. One thing as women, we've really learned to underestimate the power of our intuition and understanding that something's going on in our bodies. And I have to tell you, learning that I had stage 4 endometriosis after over 20 years of living with that disease was like such a blow to me, because I knew something was wrong. I knew it. I had gone to all different doctors. I'd been eating plant-based for so long. I was like, it's got to help. And it did help. It helped reduce my symptoms, but it didn't, I knew something else was going on and I could not get the right answers. So trust your instincts. When it comes to stress management, and also anxiety in general, if you have the resources to work with a therapist to really help balance the mind-body connection, I would highly recommend that. I mean, counseling goes such a long way when it comes to managing anxiety and depression. And also you can learn a lot of really great tools and things for yourself that are specific to you in that therapeutic process, right? Adding in more and more parasympathetic nervous system activation, things like tapping, things like breath work, deep breathing exercises, doing body scans for relaxation at night before bed. Really focusing on improving your sleep is one of the best things you can do. And that kind of starts during the daytime though, right? You want to work on the things that help improve your sleep at night during the day by reducing that by increasing the parasympathetic nervous system activity in your nervous system. So sorry, I could come back and do a whole talk just on the parasympathetic nervous system.
We'll have to have you on that, which, by the way, this is a good opportunity to plug your podcast.
Oh yeah. Thanks. I started a podcast. It's really about holistic health, women's health. It's called The Green Glow Lifestyle. And we talk about, basically all things kind of like this, and not in as much depth without, not having presentations, but I love talking about these topics, and it's something really exciting that I started this year. And if it could help you, check it out. It's called The Green Glow Lifestyle. Get your green glow on.
Yeah, my green glow on. And then I have to plug also the meal planner one last time. If you order today, you'll get that free shipping on frozen foods. Save 42% by getting the annual plan. Catherine earlier, she had a great comment in the chat. She said, I've been using the meal planner for 2 years and I love it. I don't have to think about what to cook because I meal prep on Sunday with it. So, and we're not paying Catherine. She's a real person in the chat. So thank you, Catherine. And you'll see that offer on the side there in the chat. It's pinned. And then one happy note to end on here. I saw Michelle in the chat said, I'm 52 and have been plant-based for 30 plus years. Menopause came and went, and I kept waiting for the symptoms. A year later, I'm done. So seems like, yes, that's just more and more proof, living proof that a whole food plant-based diet can really help mitigate symptoms. So yeah, any feel free to share any closing thoughts you might have, Kylie, or any final questions you'd like to answer.
I mean, you guys were great. I really appreciate you guys staying on this long and staying with us, because it is a lot, but our bodies deserve this level of attention. I really respect that you guys came, showed up, listened, participated. Keep doing it. Keep showing up for yourself, and get your glow on.
Get your glow on. Thank you so much for being here. Kylie, thank you for being here. There's still more than 200 of you here with us. So thank you. Risa, I see you asking what the code is. It's here. I'm going to send the link in the chat one more time.
It's up. Yeah. It's pinned. Okay, good. Yeah.
And if you just purchase today, you will get a follow-up email with the code to give you that free shipping on those delicious frozen bowls, which make it even easier because it's just healthy, ready to eat food. So yes, so good. Kylie, thank you so much. This was fantastic. Yeah. Thank you everyone who is still here. We really love you guys and appreciate you, and be well. Take care.
Bye.
Bye-bye. You.